I do just want to spend a couple of minutes now talking about prevention, because prevention is, I think, the sort of the aim, the ultimate aim of screening. And for screening itself to prevent colorectal cancer, we need to do two things. We need to find adenomas, and we can find adenomas with fecal occult blood testing, but there are other approaches which we might talk about in discussion later. But I'll maybe sort of bring this up just now. So there has been a study of, instead of actually using fecal occult blood test every 2 years, actually asking people if they would be prepared to undergo a lower gastrointestinal endoscopy, not a full colonoscopy, but if you like, a partial colonoscopy. And that has been really quite effective in preventing colorectal cancer. The problem is it's not so acceptable. So maybe about 30% of the population might take up an offer like that, whereas almost 60% of the population are currently taking up the offer of fecal occult blood testing. But what is good about going straight to endoscopy is that it's better at picking up adenomas and better at preventing cancer. The problem is, I think, is an ethical one. If you have a test which isn't quite as good as endoscopy, but which is accepted by a big proportion of the population, is that better than a test which is accepted by a small proportion of the population who tend to be more affluent, better educated, all the rest of it, but is a better test? You know, what's right and what's wrong. I'd be interested in your views on that. But there is no doubt that going straight to endoscopy is an effective approach. And we do have plans to see whether that might be an alternative approach in the Scottish population. Not instead of, but as well as fecal occult blood testing. So that's one way that screening can prevent colorectal cancer. But the other way is it's a method of engaging with the population. So we know, what we need to do. We know an awful lot about how we can prevent colorectal cancer. We know that if you've got a family history and if you go and get proper advice about surveillance, then that can reduce your risk. We know that if you can keep your weight under control, that reduces your risks. We know if you increase your exercise, then that will increase your risk, it will decrease your risk. We know that if you, if your diet is, if you can try to stay away from too much red meat, processed meat, alcohol, fags, all the rest of it, then you will actually reduce your risk. And you'll actually feel better in the process. So we have in Dundee, along with Professor Annie Anderson, who is one of the world's leading experts on nutrition and public health, seriously an international figure who's here tonight, and she also happens to be my wife, which has nothing to do with the accolade, but one of her brain children has been the Scottish Cancer Prevention Network, which is a network which aims to encourage both professionals and non-medical professionals to think about prevention of cancer and how it can be prevented. And we have a newsletter, a regular newsletter, and if there are some examples of this newsletter which you can pick up here at the end of the talk, and if you wish to be included on the circulation list, then if you put your name and email address here, we can circulate these to you. And there's a huge amount that can be done in the population, and one of the things that we're really interested in is using the screening encounter to try to see if people might be willing to consider changing their behaviour in such a way that will reduce the risk of developing colorectal cancer. And even if it's changing to electronic cigarettes, it might do some good. So I don't think I should say any more because we've only got 10 minutes left, and I think it is important to let you answer or ask questions. There's a lot that I was going to talk about, and there just really hasn't been time. It's one of these. The problem is if you're very close to the subject, and think about it a lot, then it's difficult to squeeze it all into an hour. But I do think that I'm a screener. I'm convinced that screening is the right way to go for certain diseases, and certainly for this disease. But I am also convinced that what we should be doing as a population is trying to reduce our risk, to stack the odds against getting cancer by engaging in screening and by modifying our lifestyle in such a way that it will reduce the risk of us actually getting this disease. So I'll stop now, and happy to try to answer any questions, although usually the questions I get at this stage there are no answers to.
Thanks.